Hi, my name is Jacqueline Cacho, and I'll be reporting the disease syphilis for Dr. Cody's microbiology class. So, history of syphilis. Syphilis was very prevalent in Europe from the 15th to 16th centuries. The Italian Wars actually initiated this European epidemic as soldiers were participating in sexual intercourse with each other. It was discovered in the 1520s that syphilis is actually contracted during sexual intercourse. Um, and up until around 1905, the bacteria Treponema pallidum was discovered to be the bacteria that caused syphilis. Um, Around World War I, syphilis reappeared, but with the introduction of penicillin in 1943, the cases of syphilis were soon reduced, due to penicillin being introduced in 1943, and as public health and quicker access to treatment increased. So some theories of appearance would be that one being that Christopher Columbus brought syphilis from the New World to the Old World, assuming that syphilis was a new venereal disease. And another theory would be that syphilis was already in the Old World and in the 1400s, and it just evolved. And that theory was introduced in 1934. So biological structure. So syphilis is spiral shaped, surrounded by a cytoplasmic membrane, surrounded by a loosely outer membrane. It's hard to determine from a gram stain procedure whether or not the bacteria is gram-negative or positive, but since it's a spirochete, we assume that it's gram-negative. The length of syphilis is 6 to 15 nanometers and with a diameter of 0.2 nanometers. This bacteria carries out anaerobic respiration because it lacks enzymes for the tricarboxylic acid cycle, and there is no electron transport chain. So it depends heavily on the host and glycolysis to carry out its functions and to produce ATP. It also consists of endoflagella to help it have a corkscrew-like motility. So some signs and symptoms. There are mainly 4 stages. The primary stage is the first stage, so that would include sores at the site of infection. These sores are canker sores, so they're usually firm, round, and painless, and they appear at sites like the genitals, anus, rectum, mouth, and the mouth, with the anus being most common. So these sores will usually last from 3 to 6 weeks, and they'll heal with or without treatment. So this first stage can easily go unnoticed. But once they're healed, the infection will stop developing onto the second stage, which is the secondary stage. Signs and symptoms don't usually appear until 10 to 90 days after getting infected, but the first appearance would be around 21 days. The second stage would include sores and rashes on the skin. The sores would appear around the mouth, vagina, and anus. And then these rashes aren't really prevalent, so they're very faint and they're not really itchy, but they will most commonly look like brown spots around the body. And then the secondary stage also includes lesions that grow in warm, moist areas, such as the mouth, underarm, or groin, and will also show symptoms of fever, swollen lymph nodes, sore throat, hair loss, headache, weight loss, fatigue, and muscle aches. And like the primary stage, the stage can also, all the symptoms will also recede with or without treatment. Without treatment, it will move on to a latent stage, and this latent stage doesn't really show any signs or symptoms, but it can last for years. So that's what kind of separates syphilis from other diseases that are similar to it, like gonorrhea, is that the latent stage can last for a very long time. And the tertiary stage, so it's usually like stage 3. So this can appear up to 30 years after infection and is very chronic, as it could attack like your body organs. So that would include like your heart, your blood vessels, and your central nervous system. There are 2 types of syphilis, and it can manifest itself at any stage of infection. So neurosyphilis would affect the nervous system. So symptoms of that would include severe headache, loss of muscle control, paralysis, numbness, and dementia. And then the second type would also be ocular syphilis, so it would attack like your eyes. So changes of vision or blindness can occur. So how syphilis attacks, or how the bacteria attacks. So treponemes will be visible in tissues and fluids. So that would include the lymph nodes, brain, cerebrospinal fluid, and aqueous humor. It'll be mostly common in the CSF in all stages of syphilis. This bacteria can travel to different parts of the body, beginning at the site of infection. So once it has traveled very far away from the site of infection, it would end up becoming chronic. That would be like the tertiary stage of syphilis. So attachment. So this bacteria can attach to cells like epithelial, endothelial, and fibroblast-like cells. There are different theories as to how it attaches. So it can attach by the adhesins at its own tips or along the length of the organism. So for motility, syphilis is very motile as it rotates longitudinally. So that's common to some spirochetes. So because it can rotate longitudinally and is very motile, it can swim through a lot of gel-like material, allowing it to adapt to unique habitats. It also obtains 3 to 6 fibrils that have a regular flagellar structure. And the shaft is also composed of many different filament proteins that will continue to help it move. This bacteria carries out cellular and humoral immune responses to endoflagella, which would allow the antibodies of the host to easily recognize infection. So, diagnosis. The definitive method for identifying syphilis would to be identify the bacteria itself using a dark field microscopy. Treponema is a spirochete bacteria, so that can be parasitic or pathogenic, and but usually, so that's like how they'll test whether or not someone has contracted syphilis. But it's most commonly through blood tests and fluid tests from a syphilis sore. So types of blood tests are treponemal and non-treponemal. So non-treponemal isn't really super effective, mostly because it's cheap and it's easier, but it's mostly because it's not very specific to finding the bacteria itself. Treponemal blood tests are usually more effective because it is specific to syphilis, because it detects the antibodies specific for syphilis. For infants, if a mother does test positive for any of these tests, the baby should be tested for congenital syphilis as well. So some cures and prevention. So antibiotics are given to help treat syphilis, but it's not guaranteed that it'll bring the body back to 100% even after all that cell damage and antibiotics. Benzathine penicillin G will usually be injected intramuscularly. Depending on what stage, more than one dose of increasing mutants will be administered in weekly intervals. However, if it's one of the more chronic stages, then the penicillin will be injected daily. Penicillin therapy is usually used for pregnant women who have contracted syphilis, and it's usually effective with a success rate of 98%. However, if the mother is allergic to penicillin, then there are other alternatives to treat syphilis. So you can contract syphilis more than once. The best way to prevent contracting syphilis is to be in a long-term exclusive relationship with a partner who's clean of syphilis and other STDs. Another way would to be use condoms correctly. However, sores can still appear in areas that aren't protected by the condom. So just being clean is the best way to go. So moving on to how often does syphilis occur today? So last year, 101,567 new cases of syphilis were reported, around 31,000 of these being primary and secondary stages of syphilis. And syphilis usually occurs more in males who have intercourse with another male. Cases of syphilis continue to increase, but it isn't as common as other STDs such as HPV and herpes. So there is a link of syphilis to HIV. So in the U.S., half of the men who had same-sex intercourse were infected also had HIV. So the canker sores that you get when you contract syphilis make it easier to pass on HIV. So if you do have syphilis, then it is easier to contract HIV. So there is not a syphilis vaccine today. The World Health Organization states that about 5.6 million people a year contract the disease. In the U.S., it's usually men who have sex with men that contract the disease, and in developing countries, it's sex workers and their clients that contract syphilis. So the difficulties in obtaining the vaccine. So it's hard to create one because the bacteria is very fragile. However, University of Connecticut health researchers reported this past summer about some information on trying to create a vaccine. So they stated that they still don't understand which proteins are on the surface, and that the bacteria only has 1,000 genes total in its genetic code, which isn't a lot actually. And they also discovered that these genes continually mutate to avoid the immune system. However, that this discovery is very important. So they're working right now with rabbits to find the proteins that don't mutate, and they're hoping to create a vaccine that can attach to the proteins that don't mutate. And as this research develops, they're hoping to collaborate with UNC to enroll patients to test if the vaccine actually works. So that's my presentation. If you have questions, then I'll answer them at the end.